Okay, have I taken this topic before? I feel like I've taken this topic before. Has this topic been covered before? Yes or no? No. Okay, fine. So, what do you understand with proximal femur? Fast, fast. It's a big class. We are already short on time. What do you understand by proximal femur? What all does it cover? Do you remember femur? It has a then no before shaft and head there is something connects your head to your body, neck. Then what comes? Somebody said something. Greater trochanter, lesser trochanter, then condyles. So in a whole of this thing, what comprises the proximal femur? Head, neck, trochanter, and if the whole shaft comes, then what is the point? Why is it called proximal femur? Proximal femur comprises all of this. The head from the articular margin to 5 centimeter distal to the lesser trochanter. Okay, you can see there marking. So that area, that 5 centimeter distal to the lesser trochanter, is called as subtrochanteric area. Sub means below, trochanteric means lesser, below the lesser trochanteric area. So neck, intertrochanteric region, and the subtrochanteric region. So all of this is proximal femur. Now, the important thing to know here is there is a capsule. This capsule is formed by the ligament around the rotation. So you are seeing the front aspect of the femur and the rotation. So this is the capsule made up of different ligaments. If you see the whole capsule from behind, the attachment will be different. So notice the attachment here is on the intertrochanteric line in the front part. So any fracture which happens inside this will be called as intracapsular. Any fracture which happens outside this will be extracapsular. Okay, so this is the front picture which we saw previously. But if you saw from the behind, this is not attached on the intertrochanteric line. It is attached on the neck itself. So which is why if a fracture happens at the base of the neck, you can treat it as extracapsular fracture. Understood? These are the ligaments forming this capsule: iliofemoral, pubofemoral, and ischiofemoral. Basically, all the three bones of the pelvis connecting to the femur. Okay. So intracapsular fractures will be fracture of the neck of femur and fracture of head of femur. Extracapsular will be intertrochanteric fracture, trochanteric fracture, that is only the greater trochanter, only the lesser trochanter, but the last will be subtrochanteric. Clear है अभी तक? Clear it out, because everything will be based on this. Whether the fracture is intracapsular or extracapsular, your treatment will be decided, your clinical features will be decided, your classifications will be decided. So अभी तक ये clear है. Now how does this fracture happen? How does this fracture happen? Simple fall. Simple fall से अगर कोई fracture हो रहा है, will it be in a normal bone or pathological bone? Pathological bone. So most common pathology happening here is osteoporosis. Happens in elderly ladies also होता है. Females में बढ़ाते नहीं. Yes, basically elderly. Elderly is the word. So these are the fractures of elderly people. Most common. If it is happening in normal bone, what has to be the force over the bone. When can you increase the force over the bone? When the trauma is severe. What is the severe trauma? RTA. Simple fall is not a severe trauma. RTA. Or fall bone. So, most commonly seen in anxiety, simple fall from standing height. Reason, osteoporosis. Young patients, RTA, fall from height. If it is happening in young patients, it is a pathological bone. What will be the pathology here? liver or alcoholism. Good. Now, significant mortality and morbidity associated with this fracture. You can see 7.5% of the patients die within the first month of hip fracture. 7.5%, which is a very high number. And 24% of them die within 12 months. After every decade, when you want to cross 50, after every decade, the chances of hip fracture doubles. That is, if you don't take care of your health. So 60, 70, 80. So as the age increases, frequency of these fractures also increases. Now these fractures are considered as fracture of necessity. So we are talking only about intracapsular fractures, which is the fracture of femur or the head of femur. These are called as fracture of necessity. What is that mean? Fracture of necessity. The fracture of necessity means if this fracture happens, it still is necessary. The four bone forearm, if the fracture happens, you do it like that. Not there, neck of femur. Why? Because these fractures not unite. Now, why do they not unite? 4 reasons are everywhere. Can you explain what is this? What is lack of cambium layer? What is cambium layer? Physiology. Cambium layer. Synovial fluid. Why is synovial fluid not there? Every joint has synovial fluid. So what happens? Pressure tamponade. What does that mean? Pressure tamponade. What does that mean? Retrograde blood supply. Any idea? Okay. The lack of cambium layer. These are the layers of the bone. You see a massive image of it. This layer here is the cambium layer. In all the bones, this layer is the cambium layer. What does it have? The progenitor cell layer. Progenitor cell layer means what? What are the progenitor cells here? Osteoblast. So this layer has the osteoblast or osteoclast. So this layer is not there in the neck of femur. So there is no callus formation, no venereum. Synovial fluid. What does it do? It acts as a toxic environment and it does not allow the fracture hematoma to spread. Fracture tamponade. Fracture tamponade means when the fracture happens, there is healing of the fracture. But because the whole thing is inside a capsule, so the pressure increases and the pressure when it cannot go out, it goes in. And when that pressure goes in, it obstructs the blood supply. It obstructs the blood supply, whatever the amount is. And retrograde blood supply means what? What does retrograde mean? Backward. Blood supply, what is the blood supply of femur? What is the blood supply of femur? What is the blood supply of femur? Ultimately, it is to go back to branch out. Yes, yes, right, loudly. Pokanda Femura. So, people actually get Pokanda Femura. These are the people having something. This one is more important. The utterance. How is the medial? How is the lateral? You know. Right. So, let's see. Medium. That's it. Volume on. There's no volume. Okay, I guess you can speed pretty fast है तो ध्यान से देखते रहना. So these are all the blood supplies: the funda femora, inferior gluteal, superior gluteal, which is a very less arterial supply, and ocular artery. Now you can see the anteriorly and the posteriorly femoral artery given the funda femora. This is lateral circumflex femoral artery, that is medial circumflex femoral artery. So in this sense you can tell which is more important. Which is giving more supply? Medial circumflex femoral artery. Which is behind. This is the anterior part, that is the posterior part, and that one is ocular artery. Now they are going inside. This is all outside the capsule. Now they are going inside the capsule. So here, this is the called what? These are called what? The आगे side होगी anterior side, preceding side होगी posterior side. What are these called? Retinacular arteries. Okay, now retinacular arteries are inside the capsule. Now they form a subsynovial ring just at the margin of head. Okay, anterior and posterior retinacular arteries, they form a ring called a subsynovial arterial ring, and these give the epiphyseal artery. So what is happening here? The blood is first coming here, and then it is going back to the head. So this is your retrograde blood supply. Understood? Now, this is your retrograde blood supply. Why is this a problem? Now if the fracture, imagine if a fracture happens here, what will happen? The blood supply will be obstructed to which part? Head. Okay, even though it is more proximal to the bone, the supply to the head is interrupted, but even though this is more distal, the supply is still maintained. So that is why the more retrograde blood supply is a problem here. So let me see in this. आइए आपको इंतजार कर. This is just how the according to the age the blood supply changes. Not that important at this point. Now it is showing if the fracture happens here. This is the fracture. The blood supply is hampered to the head. Yeah, the blood supply is hampered. Now this is going into the forehead. Okay, clear blood supply. So now you will listen to different types of fractures. So trauma. What kind of trauma is required for microfiber fracture? Simple fall is doing the job. So the severity of trauma is what? High or low? High is low. Why is it low? So after what is there, the simple fall and this fracture. Then that happens in the fracture. Even if you look, then morphologically, the next is a structure. The potential is structure. So the trauma is high or low? High. Because osteoporosis is still there. It is low, it is higher, then it is no factor. But even a simple fall can be fracture. What will change? The case will change. This is the second point. This will happen in And the osteoporosis is less. Maybe of the osteoporosis is less. At what age? 50. Yes. When is the osteoporosis high? 20 to 80. So, even though the trauma is both low, but the age is now same. The osteoporosis severity has changed. Now deformity. It will have more deformity. It will have shortening or externalization. Will muscular fracture have shortening? Why does this shortening happen? Why does shortening or externalization happen? Why is there a shortening here? Basic. This shortening basically happens. It is not a true shortening. It is just apparent shortening. What does that mean? True capacity happens. Apparently, it's true. Apparently, what happens when there is a fracture? The limb goes into flexion. Why is this flexion happening? Because this coming back to the lift part. That is flexion under the your limb goes into flexion. It makes it appear as if now, which will be more in fracture? Think. Again, think about the capsule. Yes, it is interaction. How will that? Will that make a difference? Anyone? Imagine the fracture is happening inside the capsule. The fracture is happening outside the capsule. What will happen? What will happen? The fracture is happening inside here. This attachment is still intact. So it will not allow more rotation or shortening or any deformity. Okay, but if the fracture happens here, now this is a completely free fragment and this has no support. So it can go into more external rotation, it can go into more shortening. There only a certain frequency. Okay, understood है concept? इसमें क्या हो रहा है? कंफ्यूजन किससे ज़्यादा होगा? Apparent. Now complication. What will be a common complication in local fracture? No, yes. Right? Fracture is not related. What will be the common complication for that? can say not exactly cortical zone, but more of cancellous zone. Okay? A lot of cancellous part is there. Cancellous is the deep pointy zone. Has a good remodeling or rejoining capacity. So now you can see here, trauma, simple fall, Ganga around 60, softening will be less, conservation will be less, confusion will be less, or none, what will come there? Both is there. And there is manual. Clear? I'm giving both together. Okay. Now coming back to Femur fracture, there are many classifications. People that we see, this is point here. First we see the location line. Tank system, that means you will keep it. The next is the center and the last one is subcenter. Subcenter is the second one is this four stages here is normal because of the ventilation. The ventilation. This is the alignment of the ventilation. Now in this, what is happening? What is happening in this? दो क्लासिफिकेशन होगी लोकेशन एंड गार्डन Here are team classification. Consequences. What? Lack of infrastructure. Now we come to inter-trochanteric factor. This classification is given by one. Two types. Type 1 is stable, type 2 is reverse oblique. For reverse oblique pattern, remember distance is inherently unstable. There are always unstable, there is no stable reverse oblique structure. For the type 1, there is a stable and there is an unstable structure. So type 1 is stable or unstable donor. Type 1. Type 2 is inherently unstable. Type 1 stable and unstable कैसे जोड़ा जाएगा? सबसे जो इसका पहला पार्ट है that is undisplayed. This factor becomes stable. The frequent will depend on so if reverse oblique here we got the answer. The last is subtrochanteric or lesser trochanteric. Subtrochanteric, which was given by Russell and Taylor. And then there is type 1 and type 2. So type 1 and type 2. 10 सेकंड चाहिए, 10 सेकंड 5 मिनट के लिए, ठीक है। इससे बड़ा भी बात नहीं होगा विदाउट इसमें क्लियर है। दूसरी बात है सारी सारी now this is the easy part. You should be able to answer after reading several factors. What are the things that you say? So these factors can go unnoticed or undiagnosed or untreated. Okay, the patient might complain, you given X-ray, the X-ray will look normal. डायग्नोसिस कैसे होगा? नहीं बोल दिया। डायग्नोसिस कैसे होगा? Once you have done clinical diagnosis, X-ray. Get the routine blood investigation. Why do you have to get that? Why blood investigations are important in this? Because these are required. Treatment, conservative and surgical. ये data pattern, conservative, what will it be? When will it be conservative? analgesia. Then you need to now I was asking why and why can you make control of it? Job for those who will not survive the COVID procedure. Because remember, these are very old patients. Right? And this is heart failure. The heart failure. Yes. इसमें हो गया समझो हो गया come to surgical. और एक्सप्लेन नहीं जाऊँगा. इसका बड़ा है. This people will be on. So when I told you, it is happening in one. It is happening in the high energy trauma. Both treatment will differ trauma. What are the treatment options here? As you know. First thing, when you do an internal rotation, what you do is, there is an internal reduction. Then the blood supply can be discontinued. Option to you are people to underline system. Whether it only uses young and it only use regular and the factor or a very minimal when you go. But not treated oriented factor, most of the time we use this. Because a dynamic is two. Two methods of using it, and the best two. These are the options. Intragastrial fracture, which is the neck of the fracture, which is going to be possible in the patient, either minimization or total obliteration. Only in silence, well, total obliteration. Breathe out. Back for chest infection, problem the person has been, and the next complication that will be. These are all complications of that. This is why we have to do the surgery as soon as possible. And another form of redundancy. Now one last thing. Put out. Put out.